Over the year, primary care has general practice and its colleagues have 6 protected learning afternoons, which means that we close for the whole afternoon so all of our teams can engage in education and development. It's really, really important that we have this time, even though I know it can sometimes be quite frustrating for patients, but this allows our teams to get together to keep up to date, to develop services, to develop local knowledge, and basically to just improve clinical care that we provide for North Cumbrian patients. Today we have a cancer event. Fabulous. So it's a focused cancer event so we can learn about some of the issues that we have with regards to cancer care at the moment and work together in our primary care networks and our practices to develop our systems and improve the quality of care that we give for our cancer patients.
And we're going to be looking at obviously the clinical pathways, but we've also brought together our operational teams from our practices, which is absolutely invaluable because to have feedback from our medical secretaries, our coders, admin support teams, they're the ones that are really able to tell us what happens at referral point. We've also got a colleague here from secondary care. We've been working with both the lab at North Cumbria Integrated Care and also working with our contact centre so we can really look at our whole process at a granular level and make sure that patient care is improved across North Cumbria at all levels.
Getting together to look at our processes and pathways, but also sort of to glean new information by speaking together as clinical colleagues. There's nothing ever static. Things are always changing. There's always new pathways being introduced. There's always new ways to do things. But it also gives us the chance to get together to talk about our own PCN plans. Specifically today, our PCNs are Workington, Cockermouth and Maryport, Keswick and Solway, and Copeland. The other PCNs will get together in September to have their turn. We've got 3 great presenters, 2 from the Northern Cancer Alliance, Dr. Sean Lackey and Dr. Katie Elliott, who are going to talk to us about the DARES and teledermatology, as well as FIT. And we've also got one of our cancer nurse specialists, Vicky Lammonby.
It's good to have the collaboration of the Northern Cancer Alliance, Sean and Katie. We also have North Cumbria Integrated Care, Hannah Reeson here to give her views on the struggles of secondary care so we can all learn and share best practice. My role is as a cancer engagement lead across North Cumbria is to look at the overall APCNs, working with the practices, the GP leads in partnership with secondary care, looking to improve the screening rates in North Cumbria, working with the cancer community champions.
I'm a GP of 20 years. We're here today to talk about early diagnosis in cancer and also teledermatology. One of the key messages we have that we want to get across today is how important it is to capture cancer early. The biggest thing that makes a difference when people are unfortunate enough to have a cancer diagnosis, it's the one bit of relief that can come out of it and the bit of hope that can come out from it from the patient and the family's perspective, because we know the survival rates are so significantly different for early stage cancer to late stage. We're talking about difference of 90% of people have a 5-year survival down to 5% of people at late stage cancers. So we know we can do it, we know we can improve that, and we're hoping it'll make such a difference for our patients. Each
thing that we do in primary care is actually very complex and each has a moving part, and without knowing how each part works we can't look at the overall picture. So to have everybody in the same room, operational and clinical, we're really able to find out if there's anything that we need to improve on, what's working really well. We have a lot of practices out there that are working really, really well, and to be able to share that good news and share that good practice is absolutely invaluable.
Education is a real priority for North East North Cumbria Integrated Care Board because we understand that giving clinicians time out to educate and develop their knowledge leads to improved patient care and better satisfaction.